Nora Wattie. Nora Wattie was a pioneer of social medicine, setting up Glasgow's internationally renowned antenatal care services, both before and after the creation of the NHS. Early life and education. So, born Nora Isabel Wattie on 30 May 1899 at 12 Inverleigh Gardens, Edinburgh, she was one of the four daughters of Catherine Carney Wattie, nee Dake, and James Macpherson Wattie. She lived from 1862 to 1943. And HM, or Inspector of Schools, members of the Edinburgh Mathematical Society, and previously a lecturer in English. Wattie herself attended Aberdeen's Girls' High School and in 1916 attained her school leaving certificate. She went on to study medicine at Aberdeen University, graduating MBCHB on 14 July 1921. In 1922, she was appointed non-resident house physician by Edinburgh Royal Infirmary. Patty went on to qualify in public health at Cambridge University in 1923. Patty and her sisters, that is Mary, Catherine, Patricia, established the Wattie Prize in Arts and Social Science at the University of Aberdeen in honor of their father on his death in 1943. Career. Wattie's first senior role was as venereal diseases officer in Glasgow from 1929. Wattie's approach was to encourage contact tracing and volunteering for treatment rather than the prevailing more judgmental view taken about those suffering from sexually transmitted diseases, and published her own research on improving sex education and maternity care. Patty put her proposals out to non-medical forums as well. For example, addressing 700 delegates of the National Council of Women in Portsmouth in 1930 about the substantial seamen's welfare agency's support in Glasgow. The council passed a resolution for improved medical and recreational facilities for the welfare of seamen. Wattie went on to develop her primary interest in improving the health of women and children in the poorest slums of Glasgow, and in 1934 she was appointed principal medical officer, that is for maternity and child welfare. The conditions of poverty and poor hygiene made it difficult to eradicate infections, but Wattie and her assistant Margaret Barron, who later succeeded her, convinced the Glasgow City Corporation to invest in clinics and on health education, thus improving maternal care and the take-up of immunization, which together effectively eliminated diphtheria in the city within a few years. Wattie had introduced maternal home helps known as the Green Ladies and from the color of the uniform, who supported new mothers and also established temporary accommodation in children's homes if mothers required hospitalization, that is for the birth of subsequent children. All of which was intended to improve the psychology of the preschool child and of the conditions favorable to health, mental growth, as described in a speech that he made to the public health section of the Royal Philosophical Society of Glasgow. In 1949, she ascribed the great success of the distant nurses to the fine training provided by the Queen's Institute of Nursing Services of district nursing. In 1956 to 59, Wattie served on the Maternity Services in Scotland Committee, advising on the NHS requirement and improving administration for antenatal services and links to general practice. In 1961 to 62, Wattie was elected president of the Society of Medical Officers of Health as the second woman to hold the post and first Scottish woman elected. Nora Wattie's offers chair of health board some cod liver oil in 1990. In her retirement, Patty developed health education for schools and colleges for the mothers and fathers of the future. In 1900, at Great Glasgow Health Board's exhibition to mark the City of Culture, entitled Cod Liver Oil and Orange Juice and featuring graphic displays of medical advances, its guest of honor, Nora Wattie, offered a spoonful of cod liver oil to the board chairman, Sir Thomas Thomson. Nora Wattie died on 14 July 1994.